And that brings us to our first panelist, who has been involved quite a bit in that sector. Dr. Srilekha Palle she has a doctorate in physical therapy and also an MBA. And she's a physical therapist and a leader in both healthcare communities and the Indian American community. She's a former vice president of the South Asian Public Health Association. And currently she's director of rehabilitation services at a major healthcare organization in the Washington, D.C. area, where she's joining us from today. She also is the owner of her own business called V-Care Home Healthcare Services. She assists elderly individuals with companionship, transportation, meals, and other daily living needs, because it's also a very vulnerable population. She supports, and she's been working with Vicente Ferrer Foundation for several years to help improve physical therapy services in the rural hospitals that we support. So I'd like to welcome Dr. Srilekha Palle. I'm going to stop sharing my screen now. And hopefully she will show up on your screen in a minute. I have some questions for Srilekha. One thing that's really interesting and unique about Srilekha is that she knows what it's like to grow up in rural India because she actually did. So I was hoping, Srilekha, you could tell us, there you are, hi, more about where you were born, what it was like growing up in rural India, and how your upbringing has affected who you are today.
Thank you. Hello, and namaste to all. Namaste to all the people that are residing in US, Spain, India, and I just realized that there is a person from Canada as well. Thank you to one and all, and most of all, thanks to Andre and Terry for arranging that. It's just my pleasure and honor to be part of RDT. I think going back to Kerry, I did grow up in a small town called Bethamcharla. It is a part of Rayalaseema, about 2.5, 3 hours from Anantapur. I believe Kurnool, Kadapa, and Anantapur are something that are very close to my heart because I just kind of grew up there and got educated up until my 12th grade in that same Rayalaseema region. And then I did go to Karnataka, which is a neighboring state, to study my physical therapy degree. I think if I have to kind of put it off why I feel so passionate about this cause is coming from just a middle class and upper middle class family, and being able to be educated in moderately larger towns or cities provides you a very unique perspective on what privilege looks like and feels like. You definitely become more humble after that experience. You go to Mangalore, where I got my physical therapy degree from. You go to hospitals such as Manipal, which is again considered to be a metropolitan city, where a lot of non-resident Indians come to study. And you see this world-class healthcare in private and corporate hospitals, where majority of the people that are living there are upper middle class or rich people that are able to afford that kind of world-class healthcare. And then you come back to your little town, which is Bethamcharla, Kurnool, Anantapur, and Kadapa, and you just realize that there is that section of our own people that can't afford that kind of world-class healthcare. And frankly speaking, getting low-grade healthcare system and just not having the lifestyle, quality lifestyle that you witness majority of your life. So I think that's what made me very humble. And that was kind of my experience for the first part of my 20 years of life living in India. And that's precisely why I was so, when I heard about RDT, my heart went out to the mission where they feel like passionate belief that change, not charity, is the path. So that's just how my association with RDT began.
Yeah, thanks. So when exactly did you hear about RDT? How old were you? Or when?
So, yeah, believe it or not, I did not hear about RDT back home in India. That's because, again, I come from a very sheltered family where I studied majority of my time in boarding schools. So when I came to United States about 6 or 7 years back, I can't really remember the timeline. Few years back, I went to US Impact. There was a summit. The relationships between India and United States were getting discussed. I was invited for that. So I went there. I was standing in line just to kind of grab some snacks. And one of my friend that I went to started speaking to the then executive director, Angie, and I kept hearing the word Anantapur, and I kept looking behind because I rarely hear that word Anantapur in this. I think by far that might have been the first time I heard out of my friend circle. And then I just went to Angie. I said, I can't help but keep hearing Anantapur. Am I mishearing you? Because Angie is this white girl full of life and was kind of talking about it. And she's like, no, we have our organization there. And then the summit started, but I couldn't focus on summit. I was just beyond elated to know that there is an organization working in Anantapur. So I literally started stalking her, and she responded to me about 2 weeks after, apologizing, basically saying that she was tied up on other projects, but she was intending to get back to me. But within that 2 weeks time span, I probably texted her 10 times saying that, what can I do to get involved? I'm just impressed that there is an organization out of Washington, D.C. working in my remote areas. Love to be part of it. And that's just how the relationship began.
Yeah, that's really neat. And so it's part coincidence, part like fate, maybe, that you found your way back to a similar community. So there's a project you were involved in the beginning, I think, called Prescription for Hope. And I was wondering if you could tell the audience a little bit about how you chose to get involved in that, what it is, and how you were involved in that.
Sure, Gary. Prescription for Hope is like an expertise exchange program in which healthcare professionals from around the world travel to BFF's hospitals in India. I believe Kerry just showed those 3 hospitals to share their wealth of knowledge and with local providers, and also gain knowledge from local providers. The thing that truly impressed me about those hospitals that I shadowed for a week or two was how clean and what quality of healthcare was being provided, and a passionate healthcare that was provided. Just within the campus, one thing that really struck me is there was this huge line in front of pharmacy store. Outside of that campus, you will basically, if you kind of know Indian culture, people want to get ahead in line and they don't want to stand and stick to the line. But within the campus of the hospital, I was just impressed of how disciplined people were standing in the line. That just made me that I think it's all about the mission. If people believe in the mission, they'll follow through everything that you ask them to do it. So basically, this is, again, expertise exchange program. Along with me, there was a cardiologist when I went in 2 years back. And when I traveled to Anantapur, shadowing doctors and physical therapists, we did some screening camps and rehabilitation clinics where orthopedists from London was present. We also did a lot of other women empowerment projects and worked on them. But basically, this is a way for us to offer our expertise and recommendation, and also gain some knowledge. Through that process, I understood more about the infectious control practices, and also try to understand more about where the lack of infectious diseases processes is coming from. So I was able to come here and send some materials from here in order to ensure that we get that program started in our DT hospital.
Yeah, that's great. So even though your specialty is physical therapy, you're able to help in so many other ways, and just medicine in general improve. That's great. I did want you to share with us too, like some of the other work you've done since then. So I know, that inspired you even more, and you've done a lot of work and a lot of support since that program. So can you tell us a little bit more about?
Sure, Kerry. I think more than anything, I enjoyed the women's core team. I know feminist is not a very great word in this day and age, but I always consider myself as supporting more of women and children and people with disabilities. That's basically how I got into physical medicine rehabilitation. So I really kind of enjoyed the sports aspect of it, where girls, teenage girls, felt empowered that they can get somewhere if they only put the hard work and the discipline that came with those sports and sports places. The women's core team, as you know, it was formed by senior women staff members from all the departments in Cater. And I felt that it created a space for women staff members to express freely. And Kerry, I think you started off saying that it is a patriarchal society. No, India has kind of come way far than when I lived there 20 years back. But I still think there is certain aspect of patriarchal society, and it's more in the rural areas. But this women core teams gives them the confidence, like self-care. Sangams is what they call. They kind of all the like-minded women empowering each other. And then they have the space not only to discuss, but also they're building training and capacity building. They're influencing the teams to improve and participate and take care of themselves and their health, their maternal health, their infant health, and also trying to incorporate gender approach in all these activities. I think that's what was something that I'd really cherish going back and serving and being with those women.
Yeah, that's wonderful. Yeah, I'm glad you've been able to spend so much time there and contribute so much. I wanted to show the audience a couple photos we had of you, some of your work there, and maybe you can tell us a little bit more about some of it. Let me see, like here's a photo. I just was wondering, I thought people might like to see rather than just hear what you were doing. Sure. So do you remember what was going on in this situation? Or?
Yeah, a patient actually was having severe back pain. So that's like one of the piece of equipment people that have gone through physical therapy kind of understands. It's like an electrical stimulation modality. We call it as physical medicine modality, where we are trying to work on pain and stuff. That's a physical therapist, Mohan, amazing physical therapist. He was able to kind of identify and was treating based on his intervention and plan of care.
Okay, great. And here's another one.
This was actually a gentleman. I remember I had a very good conversation. I think it helps me because I understand the language and I speak the language very well. And I actually love to speak that language. So I think I had a wonderful conversation. I felt like it was, he came from a village and obviously he went through knee replacement and was exercising along with the physical therapist. But one thing that he continues to ask me is if he'll be ever able to squat, because that's what it requires for him to continue with his agriculture.
Okay, wow. Yeah, I know we don't think of some of these things, right? Why would you need to squat? There's so many reasons he needs to squat for his livelihood. So yeah, that's good. Yeah. And also, you've also helped support us in VFF USA in getting more equipment for some of the rural areas. So I'm not that familiar with this equipment. I thought maybe you could tell us a little bit about the equipment that's needed there, why, or what these types of equipment are.
The hospital, for the rural hospital, I felt like they had good equipment, but like any other clinics, even in my own clinic, I manage physical medicine and cardiac and pulmonary rehab. We are always enhancing our equipment. So never to degrade one equipment or the other, but that was a newer equipment that we were able to collect funds and develop. It's for strengthening of your lower extremities. And that's more of a posture, standing and doing a lot of hand therapy rehabilitation.
Okay. This one is hand therapy? Yes. Okay. That's interesting. In this one.
And that's parallel bars, ramps, as you know, especially in India. It's not very ADA accessible. So it's imperative that we have a ramp in every physical therapy or rehabilitation clinic. So we practice going up and down the ramp. So that's just how the life in India begins. We don't have the, again, ADA accessibility is very limited in rural parts of the country. So they should be able to do that before they completely graduate from rehab.
Yeah. Okay. So that's great. Yeah, I just wanted everybody to know the impact you're having. It's really wonderful.
If I may, Carrie, a couple of things that we are still looking to buy for that rehabilitation gym is laser piece of equipment. In United States, laser piece of equipment can go anywhere between $2,000 to $5,000. But I know in India, you could bargain it for lesser price. So if anybody is willing to make a donation, please contact either Carrie or Andre, or you can reach out to me as well. That's one piece of equipment I really was planning to get it in 2019, but I had a different priority. In 2020, COVID hit, so I didn't want to keep going back to folks asking for donation, but that's something that I really intend to bring it back to the rehabilitation area.
Okay, no, that's great. Yeah, we'll definitely, after this, we're going to send an email out to everybody, just a kind of recap of what we talked about, and we'll add that to that as well. Thank you very, very much.